Welcome, everyone, to another live Mast Cell 360 show. I'm Jamie Fries-Miller, your host and health coach here at Mast Cell 360. Whether you're joining us live right now or catching the replay later, we're so glad to have you with us. These lives are all about empowering you on your mast cell journey with practical insight, expert guidance, and the support of our amazing community. While we're waiting for everyone to hop on to today's call, go ahead and drop in the comments, where are you tuning in from? We really love to see how global this community is. And I can tell you today's show is going to be a really good one. I'll be joined by our lead practitioners, Alex Bingham and Kimberly Quirk, as well as our emotional support coach, Elle McKeel. And our special guest today is Dr. Achina Stein. Before we get going, I'm just going to go over our quick disclaimers. Today's presentation is for informational and educational purposes. It is not meant to treat, diagnose, cure, or prevent illness. Be sure to discuss any health recommendations with your healthcare provider who's familiar with your case. Just a reminder that some of the links that we share today during this presentation and on our website are affiliate links, which means Mast Cell 360 may take a very small commission if you purchase through us. We only recommend products that we love, use personally, or use in the Mast Cell 360 clinic, and your support helps to contribute to our ongoing free resources just like today's show. So thank you so much for your support. All right, so what are we going to be talking about today? It is mold month, the end of mold month. And last week we talked about gut health and mold. And today we're going to be talking about how brain and emotional health can be influenced by hidden root causes like mold. We're going to be talking about how mold affects your body and the impact on your brain. We're going to be talking about the functional approach to healing and restoring health. And we're going to give gentle and practical steps for supporting both the mind and body. And of course, if we have time, we will do a live Q&A. Please remember that we are unable to answer in-depth personal health questions. And we ask that you only ask your question once. It helps us keep track. And please keep it on the topic of today's show, mold and mental health, mold and the brain. Okay, so let us bring our guests up to the stage, lead practitioners, Alex and Kimberly. And let's see, there's Elle. And today's special guest is Dr. Achina Stein. Dr. Stein is a board-certified psychiatrist and functional medicine practitioner with over 30 years of experience. She was a clinical assistant professor of psychiatry and human behavior at Brown University for a decade. She's a distinguished fellow of American Psychiatric Association, a fellow of the American College of Neuropsychiatry, and was awarded the Exemplary Psychiatrist Award by NAMI RI in 2008. She is the best-selling author of What If It's Not Depression and the clinical director of Healing Depression Project in Austin, Texas. Her private practice, Functional Mind LLC, is in Providence, Rhode Island, and there she integrates psychiatry and functional medicine to uncover root causes of brain and mental health challenges. She lives in Rhode Island. She's been there since 2000 with her husband and her 3 adult children, and she loves playing ultimate frisbee, singing, and gardening. So you can find her at fxnmind.com if you would like to learn more. Okay. Let me remove our slides here and let's get into the conversation. Dr. Stein, thank you so much for being with us today.
Oh, thank you for having me.
Yeah. Can you tell us? Yeah, thanks. Can you tell us a little bit more about how you got into this work?
Sure. Yeah. It was quite some time ago. In 2010, my son, one of my sons, got acutely depressed and suicidal overnight. There was no signs of this happening. Overnight, basically got into a tiff with his brother. It was typical adolescent tiff. And he was suddenly so depressed that he decided to stand on a ledge 5 stories up and was ready to jump. And he climbed out of a window out of this suite that we were staying in France. Actually, we were there for a few months. We were homeschooling the kids, and he did this suddenly, impulsively. And me being a psychiatrist was like, oh my gosh, what's going on? How could this happen? What did I miss for this to happen? And obviously I talked him out off the ledge and came back in. And the thing is, my initial thought, and I was still a conventional doctor, my initial thought was that he was having neurological issues because he also couldn't read anymore. And he was an avid reader, loved to read, had a photographic memory, and he just couldn't read anymore. And so that's when I thought, like, okay, I've got to get him to see a neurologist. Even though he had depression and insomnia, he had all the symptoms of major depression and anxiety. I just didn't think it was a psychiatric disorder. So, but he was seen by a psychiatrist, started seeing a therapist, did see a neurologist, and they didn't think that was the case. They just said, oh, he just has double vision. It's like, what do you mean he just has double vision? Like, it just didn't make any sense to me the way it all happened. So I had to dig deeper. And fortunately, I serendipitously learned about Ed Levitan, who at the time had a practice called Visions Healthcare. And I brought him, my son, to see him, and he was found to have celiac disease. He was nutritionally deficient. He had all sorts of issues. And when we put him on a diet, gluten-free, dairy-free diet, because he had celiac disease, he had felt significantly better within like 1 to 2 months. Did some food allergy testing, found that he was soy allergic as well, soy sensitive, I should say, and pulled out the soy, and found that his lifelong eczema, lifelong severe constipation completely remitted. And his mood got significantly better, but not all the way. Now, mind you, I didn't even tell you that he was put on 4 medications, psychiatric medications in the process of a year. And, he certainly wasn't suicidal anymore. He was a little bit better, but certainly not my son. And so, in that time, from the time that he saw Dr. Levitan, in a year, he was, practically off all medications. The thing that didn't remit was the double vision. That took a few years. It took like 2 to 3 years for him to have complete improvement of his vision. And it was to the point where we had to have all of his textbooks on audio tape, or we would read to him when he was going through school. So anyway, yeah, he got significantly better. He also was no longer taking medications within 2 years. It was complete remission. And so as a psychiatrist, when you see something like that happening, like, I couldn't go back to doing conventional medicine anymore. So fortunately, at the time, Ed was actually looking for an integrative psychiatrist. And I asked him to hire me. I left my job as a medical director of community mental health center that I was at for 10 years to go learn functional medicine. And that's all I do right now. People seek me for this kind of work, especially as a psychiatrist. I gave a whole talk on functional psychiatry 101 at the Institute. The Integrative Medicine Mental Health Conference in San Diego that just happened. So I've come a long way, and that this is what people seek me to do, to resolve their mental health issues and get them off medications if possible.
Yeah. Wow. Your son's lucky to have such a attentive mother that was like, we're going to get to the root of this, right? And not just accept something. That kind of leads us to my next question. Everyone sometimes, not everyone, but a lot of people chase that diagnosis, right? So what is your view on getting a diagnosis?
Well, it is helpful to get a diagnosis if you are looking for an acute treatment. Sometimes it's good to know what you're dealing with. I actually got off the phone with a person earlier this morning who says that, we were really relieved that my daughter got a diagnosis of chronic fatigue syndrome. And, sometimes it gives you some relief, like, oh, this is something that lots of people have and have dealt with, they know about. So it's nice to have a name or a label to a complex of symptoms, but that doesn't tell you why you have it. It's great for matching a pill to an ill. It's great to look at the research. You can put in chronic fatigue syndrome or major depressive disorder to see all the research about it. So, you want to put people with similar diagnoses as participants for research. So when you're testing out treatments, you have an idea that this group has similar diagnoses. So, and it's good for insurance purposes. You have a billing code, to be able to bill for insurance. So diagnoses give some relief that this is not something that's out there all by itself. And that there might be some really good conventional treatments for it, which, great, if that helps you, awesome. But it doesn't really look at the root causes. And so there's different root causes for different illnesses. And some of them are just specific for those illnesses, but there's lots of diagnoses that have the same root causes. And so when you do functional medicine, you can actually resolve like 10 different issues by one root cause, and which is the common denominator is inflammation. So finding where that inflammation, what's causing the inflammation, and turning off the tap and letting out the drain of that inflammation really makes a big difference.
Yeah. No, and we're a remote health consulting clinic, so we don't treat or diagnose here at Mast Cell 360. And people come to us being like, "How do I get that diagnosis?" Or "Do I need a diagnosis to work with you?" And the answer is no, because our approach here is to get to that root cause. Can you explain, a little bit more about your functional approach to mental health versus the conventional approach in a nutshell?
Yeah, I mean, I'm hearing a lot of feedback. I'm sorry. So yeah, what I do is I gather a lot of information, and many psychiatrists, at least, they used to gather long histories, starting from childhood. And so I usually get history, literally from prenatal history through childhood, all the things that impact you, dietary, even the diets, even during early childhood and the teen years. It's looking at all the things that have impacted the body, whether internally or externally, and putting it all on a timeline. And so when you put the history on a timeline, you're able to see how it's all connected, and then you want to basically look for how one impacts then the next impact, then the next impact. We're looking for perfect storms that causes the immune system to then sort of go kaput. And so when those things happen, then you're able to sort of figure out what were the things that impacted the immune system, because 80% of your gut is your immune system, right? And so when you impact the gut, you're going to impact the brain. So, but how it's been impacted gives you clues as to what the root causes are, and then you go after those. But generally, so when we get that timeline, then we generally start with diet. Diet will always help. And the diet is basically chosen based on where the person's at the time, what kind of diet they have. And then we personalize it to effect a specific target change. So lately, I used to recommend a modified paleo diet, and taking out a lot of the carbs really makes a difference, especially grains, and increasing protein. People don't eat enough protein; they eat way too many carbs. I call them carbitarians instead of vegetarians, because even vegetarians really don't eat enough vegetables. I strongly believe that you have to eat enough vegetables, a variety of vegetables, and rotating them in order to feed the microbiome. And then increasing the protein and fats. And more I'm going, especially for mental health issues, going towards a ketogenic diet. There's some great information coming out now about how the ketogenic diet a therapeutic, healthy ketogenic diet. I know sometimes ketogenic is a trigger word for bad, unhealthy foods, but there is a really healthy ketogenic diet where you're eating healthy fats and making ketones for the brain, supporting the mitochondria. Even for a 6-month period, that can make a huge difference in resetting the mitochondria. So we start with diet, and it doesn't always have to be the ketogenic diet. We start with generally a modified paleo, and whether it's vegetarian or not, going and basically looking at how the person feels in order to know how much to push the protein and the fats. But carbs are a big cause of mast cell issues, as you all probably know. We can get into that later if you want. But then we do testing to look at what the gut looks like, whether or not there's increased gut permeability, whether or not there's gut pathogens at play in creating a dysbiosis, whether there's H. pylori. So looking for those pathogens, and then setting up the body to be able to handle any type of what we call kill phase, in addressing those pathogens, depending on what they are, whether or not they have small intestinal bacterial overgrowth. So looking at the whole system and then creating a plan to the right order of things. It has to be the right order of things to address these issues. And so, I know we're going to talk about mold, but understanding whether or not mold is a player is really important to know way up front, because people will not get well if they don't know about the mold or address the mold. So we do a really good history in terms of whether or not there has been previous mold exposure or current mold exposure, where they're living currently in a mold environment. It's extremely important to look at those things. Because you want to know what mold that it is, and then to address those things early on. But again, you want to prepare the body to be able to handle that, because people will Herx. There's a reaction, which I'm sure you've talked about over and over again on your show, the Herxheimer's reaction. So important to understand that and address that early on, prepare the body for that, so you can tolerate and have a smooth transition through mold treatment, and even treating the gut pathogens, particularly Candida, because Candida does release toxins that can cause a pretty severe Herx reaction. So if you're not careful and you don't know what you're dealing with, then you can make a person sicker than and have difficulty tolerating these things.
Thank you for that overview. And that's exactly what we do here at Mast Cell 360, is we have a whole stabilization piece to our operations to be able to help people get to that place where they're able to detox.
Yeah, I didn't finish. I should have also followed up with, we then after that go to a reinoculation repair phase, repairing the gut lining. And there's ways of doing that. And, there's pretty standard ways, but the last piece is rebalancing. And some people don't really understand what that is. You really have to go back to the beginning of the drawing board and understand what were the drivers that put that person there. And some of those drivers are emotional drivers: being a perfectionist, being really hard on yourself, having feelings of guilt and shame, kind of beating yourself up, so those are so important to address. Our limbic activation, so brain retraining is really important. Looking at the mindset, looking at whether or not you love yourself, care for yourself. These are all really, really important, so that you don't re-trigger these processes again. And it's also really important to make sure that you keep working at it, because just like a garden, if it's full of weeds, every season you need to work on the terrain so that these pathogens don't come back. So just like you would till the garden and put fresh soil and fertile soil and adding nutrients to that, every year that you do that, there's less and less weeds coming back. So I loved using garden analogies when I'm addressing these kinds of things. So really, really important to keep at it, because Candida in particular comes back. It comes back, and you have to pay attention to that. It kind of seeps in really slowly, and so you looking for those, remembering, writing down the symptoms that you had that went away, they start creeping back in. You want to jump right back on that.
Yeah. You've obviously done incredible and considerable work in this field. So I think it would be, as you alluded to, we're going to talk about mold a little bit, and it's the number one root trigger at Mast Cell 360. So before we jump into some other questions, I think it would be helpful for our audience if you could maybe share like the connections that you see between mold and the brain or emotional health, and then maybe what are those symptoms or conditions that are common with mold exposure that you see?
Well, I mean, it's the gambit. I've seen the whole range. I've seen severe depression, like can't get out of my chair, can't function from mold. I have a patient who's severely depressed who lives in an extremely moldy house, and she's not remediating because it's too expensive. She's trying to get it ready to sell, but she's so depressed that she can't even do that. It's really sad to see that rather than just moving out. Sometimes you just have to leave homes like that. You've got to get out of the environment. But to finish answering your question, I've seen panic attacks and psychosis, even dissociation, derealization, attention, ADD. I mean, you could see the whole gambit from mold. I don't think there's any symptoms that aren't seen, at least by me anyway. I mean, I see the whole gambit. Mold is always a big thing that I look for. So it's pretty common for most of my patients, actually, because by the time they see someone like me, they have everything. They really do have every level of every root cause, basically. So. So I think you had a second part of that question, which I'm not remembering. What was the other piece of that?
Let's see. Was it symptoms? I think you answered it, like the connections between mold and emotional health, and then like what symptoms or conditions are common. So yeah, you kind of just, we know that mold affects the gut and that the brain, and if the gut's off, then the brain is going to be off as well.
Right. Right. There are 3 or 4 molds that are more common with mental health issues. Black mold is very common with cognitive impairment. That's Stachybotrys, fatigue, mood swings, and depression. Aspergillus species that produces ochratoxin and aflatoxin. That is really common with mental health issues because it causes dopamine and serotonin depletion. Penicillium species also produces ochratoxin, and Fusarium species can cause this. It actually causes sphingolipid metabolism. People probably have not heard of that, and that's really, really important for neuronal membranes and signaling of those new neuronal membranes. I can't speak today, but those are the really most strongly associated with major depression. And I don't think we have enough research to really look at all of the other issues. Major depression is the one that's most studied because these mold toxins cross the blood-brain barrier and they disrupt the serotonin and dopamine balance, and they inflame microglia, which makes them the highest risk for driving neuropsychiatric illness, including, other issues as well. So.
Thank you. That was a great overview. I'm going to pass it over to my colleagues now because I know they have some amazing questions for you. Alex, would you like to get us going? I did mute you, so let me unmute you real quick just to keep the background noise down today. All right, Alex.
Okay. Well, it's great to see you again, Achina. And we've worked together years ago, but we've each gone our separate ways after that. So I'm sure that in the last 10 years or so, we've each discovered many new things. But in the limbic system, and we include the vagus nerve with that, how do you weave that into like mold and MCAS treatment?
Well, yeah, I mean, yeah, the limbic system, I like to send people to do brain retraining. I actually have a somatic therapist in my practice. She was trained through the biology of trauma. So right from the get-go, we have people learning somatic tools in order to help and learning vagal nerve stimulation. But there are some people who also need the brain retraining. So I send them to Ashok Gupta's program, the Gupta program, or Primal Trust, one of those two. There's several others. There's Reorigin. So depending on the person, their personality, and what their issues are, what the, whether it's sexual abuse or child abuse versus chronic medical and medical mental health issues, we try to match the program to their needs as well. But limbic activation is something that needs to be addressed, especially if people don't feel safe. They don't feel safe in their bodies or in their environment. It's really, really helpful to address those right away, right from the get-go, because you will not heal if you're kind of stuck in fight, flight, and have this limbic activation.
Great. Oh, Alex, do you have a follow-up or?
Well, no, not exactly. But I know that for me, that was kind of like we learned about chronic fatigue, then we got fibromyalgia, then mold came along, Lyme disease, heavy metal, MCAS, and the limbic system and the vagus nerve were such a breakthrough idea that really connected the mind and the body for me. So I'm always curious to hear how other people are doing the same thing.
Oh, absolutely. It's really important for people. Well, we try to pick that up again really early on. I mean, my population having mental health, a lot of them have trauma or mental health issues. So we definitely screen for that. And so the tools are so simple to do. There's the VU and there's reorienting, just even reorienting yourself in the room. That's like looking from behind all the way around and just looking at every corner of the room. And that alone, just doing that one thing, calms your whole nervous system down. And people don't realize it's almost like it's a sixth sense. It's a primal sense, a primitive sense that we kind of ignore, but we should really actually value it to the point that sometimes it's what saves you. It saves your life sometimes. There was this book called Fear. I forget who the author is, but he talks about that. Like if there is like this bristling in the back of your neck, there's something that your body's sensing that's not safe. And you got to pay attention to that. It's really, really important to pay attention to that and respond and get to know what we call the dashboard of your life, you have the lights on the dashboard of your car. You have to get to know your own dashboard. You have your own signals that you've tuned out or ignored or just weren't aware. And so doing somatic therapy and learning what your signals are and paying attention to that really helps you to understand that this is the way your body's trying to speak to you. You've been ignoring it and calling it illness or disease or disorder, rather than this is my body speaking to me. It's telling me something. And an example would be like this feeling of dread, right? Or a lump in your throat or a tightness in your chest. And it might be the most minuscule tightness. It could be like, oh, you're going to go to a meeting with your boss and then you just tighten up, right? And that tightness, especially, it could be up here in your throat, it could be in your chest, it could be in your belly. That tightness could be enough that it's causing you to be constipated. And if you zone into that and just release that, you might start having bowel movements again. You know what I mean? So it could be that subtle, and it makes all the difference in the world.
Yeah, I noticed that before bringing this into practice, that there were a number of people that couldn't tolerate they generally had intolerances to food or supplements, chemicals, light, sound, those types of things. And I couldn't get anywhere until people did this. And then started hearing people, they would come back and say that after doing these programs, that all of a sudden they could start talking themselves down from that place of kind of like dysfunction. And then we could move ahead with some of the more supplement, more physical aspects of what we were doing.
Yeah.
But I'd like to give others a chance to ask too.
Yeah, Kimberly, do you want to unmute yourself and ask?
Yeah, so something that we see quite a bit is people presenting with anxiety, right? It's a lot of anxiety, and it's hard to know, is that brain driven or body driven, or a little bit of both, right? And yeah, right. So for sure, histamine's a huge piece for mast cells, right? And the mast cells releasing more histamine, and then people end up on anxiety meds and things like that. It's not really addressing that root cause. And would love to hear your perspective on, the H4 receptor and which is in the brain, right, for histamine. And histamine is a neurotransmitter that people don't always think about that, and how much that drives some of those symptoms.
Right. Yes. So, histamine definitely causes a significant amount of anxiety to the point of panic attacks. It is something that it's tough to treat because there's so many different types of histamine. So you want to address all of them. And it's going to be, everyone has a different, what's the word I'm looking for? Like some people respond to the H1 blockers, some people respond to the H2 blockers. Then, so it's looking at all of the different ways to address the histamine load. And then you also want to be able to digest histamine, so that, making sure that the body is releasing the histamines by digesting them. So it is a matter of stacking all of these supplements, and unfortunately some people have to take quite a few in order to get control over it. So the histamine 4 receptor is something that's in the brain, and how do we address that is by looking at neuroinflammation, the microglial activation, blood-brain barrier permeability, and how the H4 receptors affect, these, it modulates the cytokine release, which is IL-6 and TNF alpha. So in terms of how to address that, you really want to look at what's causing the inflammation. And, there's no real medication to give for that. So it's just looking at the mast cell activation and looking at what's causing the mast cell activation. So mold patients often have that, and the H4 receptors amplify this histamine-driven inflammation. Not sure if I answered your question, but
yeah, absolutely.
It's so complicated. The histamine system is very complicated. They have, it affects your brain, it affects your mood, and it affects your immune system, all 3 areas. And some people have more H2 than H1. And so that's why you have to kind of hit all the histamines receptors.
Thank you.
Yeah, you're hitting on a lot of what we do in our clinic is we have to stabilize, right? And so part of stabilization for us is the nervous system, and we also direct people to Gupta and Primal Trust because we recognize that. And then, you mentioned some people need a lot of different supplements or things to kind of stabilize and bring that load down. We talk a lot about that histamine bucket and what is filling that bucket.
Right.
It's very person to person.
It does. Yeah. Some people are harder than others to manage. And you're not going to know, at least I don't know, who's going to respond to what. You can only try them. And it's not just supplements. There's also some really good medications out there too. So, I'm not anti-medication. You want to use all the tools in your tool bag. So I have the conventional background, but also the functional background. And so you want to use lifestyle as well. So stress reduction will absolutely reduce. It's not just medications and supplements. You really have to work on the stress. Stress activates histamines as well. One thing to follow is looking at the eosinophil levels. There's certainly tests that you can do to follow whether or not you're impacting the histamine levels is by following certain labs like eosinophils. There's not a whole lot of testing that we can do. I don't know if Alex has some tests that you follow to see if what you're doing is actually making a difference. The other thing that I like to follow is just the general, MSQ score, multiple symptom toxicity questionnaire. I use that on every single visit, have my patients complete that. And we're just looking for an overall reduction in inflammation, not just neuroinflammation.
Yeah, thank you. Elle, do you have a question for Dr. Stein? Oh, you're muted. Hold on, let me unmute you.
Thank you.
There you go.
Thanks. Yes, well, yeah, so I do a lot of the support around mind, body, emotions, nervous system here. And I'm still learning some of the, relationships with aspects. So I know you talked a bit about just how all this can affect your mood, including the inflammation itself, the gut, interrupting neurotransmitters. Is there anything else that you haven't talked about that that's a pathway for affecting people's mood, how they interpret things? Other than, I know the nervous system itself is a big mediator for how we perceive things.
Yeah, I mean, I don't think I'm a psychiatrist, but nowadays psychiatrists don't do psychotherapy, but I'm well trained in psychotherapy from one of those dinosaurs that did psychoanalytic psychotherapy back in the day. So, but yeah, I think therapists have the unique vantage point of looking at the psychodynamics between people. And so I think it's important to understand what a person's worldview is. Like, where are they in the world, and how do they impact the world? And do they think that they have a sense of purpose? Having purpose is so important. Just that alone can cause a person to become very, very ill. Feeling helpless in a situation can make you so sick, even though you might have all the skills in the world. If you don't feel like you can impact another person's life in a positive way because you've been beaten down throughout your whole childhood, being told that you were stupid, or it's just, it can really, really cause you to be sick, very, very sick. Feeling heard and feeling validated is so important. And I feel like we as functional medicine providers are taught to do that, because in the conventional world, people are gaslighted all the time. They are told they don't know what they're talking about. Oh, stop looking at Dr. Google. And, I like people who search for answers, because they're the kind of person that I want to work with. They're already thinking about how to get well. I want to get better. It's already present. And you can feel like, I just want to get better. And so I like it when they're doing that, because they're trying to find answers, and I want to be able to help them on the right. They're talking to me because they want to be put on the right path. They know they don't know everything. So I'm hearing a lot of feedback again, but it's really important to be where the patient is, just trying to sit in the seat that they're in, and have empathy about their situation, and try to get their sense of where they are in the world and how they can feel a sense of purpose.
Yeah, that's so important. We definitely see a lot of people having those experiences, and I know I've had some of that experience, some others, as far as the validation, then also finding purpose, and that helping a lot.
Yeah. Another thing that I'm just thinking of is it is helpful to get an ACE score. Are you familiar with that? Adverse childhood events, because the higher the ACE score, the higher the likelihood is to have chronic disease, particularly heart disease and many other issues. If people are not familiar with that, it would be good to learn more about that. But I think it gives some people an understanding about, why am I so physically sick, even though I might be over the trauma that happened to me as a child. And you might have done a lot of psychological work, over the years and feel like you got past it, but then your body is still really, really sick. And so it's taking a look at how your childhood trauma sets you up for chronic disease, because then it informs you about what you then need to focus on. And that's where, again, the somatic tools come in. It's retraining the body to calm down. You have to train the body as well. It's not just enough. It's not enough to just do the mind. And it's not enough to just treat the body or, treat the gut. You've got to calm your whole system down and not be in this hypervigilant mode. And that's where somatic tools come in. That's where the mind-body therapies come in. And you really have to slow everything down and sort of reset the nervous system. It's a resetting of the nervous system. So it's extremely important to do things like the Gupta program, especially when you have early childhood trauma.
Yeah, definitely. And that's something we see too, or I see with some of the work I do, it's actually a lot of it's body up. And so we'll see when people have experienced trauma, or even maybe their medical trauma itself, just even connecting to their core is something that they didn't necessarily realize wasn't, they've been affected. And so, we try to support but meeting the nervous system where they're at, because sometimes, there can be resistance if it's new or different. It's been a while.
Right. It's helpful to also say, like, where do you think your body is? I've had patients who are always feeling like they're floating. Yeah. They're floating, or that they feel like they're ghosts. So it's really interesting to get a sense of how they feel in their body, or where their body is in space, Yeah.
I think the nervous system piece is so prevalent, but you've also alluded so much to the gut. And I feel like from a functional perspective, we get a lot of clients who have done the functional approach, and then they come to us, and some of the stuff we do to stabilize the gut with diet and things like that you had mentioned.
Right.
We also know, gut issues contribute to a lot of nutrient deficiencies. So do you see that commonly in your population? And then I know Kimberly and maybe Alex have some follow-up questions regarding what nutrient deficiencies are being affected that are really affecting the brain. So Kimberly, I'm going to turn it to you, but after.
I mean, I can answer that question right now if that's the question.
Yeah.
So magnesium deficiency across the board, zinc deficiency, B2, B6, sometimes B5, vitamin C, vitamin D. So those, and even vitamin A and E sometimes. So when I see all the fat soluble vitamins deficient, then I think, there must be some kind of gallbladder issue, gallbladder congestion. So when you see certain vitamin deficiencies, it actually helps you to look at where the root causes might be. So just like if there's protein, low protein across the board, then when you do an amino acid profile, then you're going to think, okay, digestion. So, they're having difficulty digesting proteins. So I always start with digestion in my practice. Actually have everyone, even before they meet with me, do a burp test and a colon transit time, just to make sure that they are, evacuating efficiently. Some patients will say, oh, I have a bowel movement every day, but they're not evacuating for, completely for 3 days. So it's certainly if they're constipated and have a bowel movement once a week, then, you don't have to do the colon transit time, but it is helpful when you're having daily bowel movements to still do the colon transit time, and just to get a sense of how well they are evacuating. And the burp test tells you whether or not they're making enough acid. And then when you get the stool test, then, you can look at pancreatic enzymes and the steatocrit to see how the whole system works in terms of fats, digesting fats, proteins, and carbs. And it's really important to look at digestion and being able to absorb, assimilate, in the cell all of the nutrients. But For mental health, B6 is extremely important. It's I think it's one of the vitamins that is least talked about. But B12 and folate are often associated with mental health issues. But I think we always forget about the complex of all the B vitamins, particularly vitamin B6.
Yeah, I would agree with that assessment. B6 we see quite a bit. B2 and B6, B1.
Yep, B1, yeah.
B1 for running your mitochondria. Your brain is your biggest user of glycolysis and ATP. So it makes so much sense if B1 is low. And if we've lost foods because of mast cell, of course, there's going to be some nutritional deficiencies, and what those are. We typically use like a metabolomics or some kind of organic acids and amino acids testing to really target where those are. But that's assuming it's somebody who can onboard the supplements, because we have a lot of people who are so hyper vigilant that they can't onboard the supplements.
Right,
and that's where the nervous system piece comes. Yeah.
Right. Absolutely. Absolutely. Yeah. So zinc, it's important to have zinc and copper balance. One way I know that candida is a big problem if the copper is really high and the zinc is low. Other ways that I know candida is like entrenched or ingrained in your system is oxalates, high oxalates, high estrogen. So if someone's estrogen dominant, they're going to be probably full of candida. So, and that's how it's looking at those factors that make me make me believe that, okay, this is going to be like a 3-month candida thing or a 4-month candida thing instead of just 1 or 2. So it's looking at the whole picture. That's really, really important.
Yeah, we see oxalates a lot too. Yeah. And it's so cyclical too, right? It's like
it is.
Can't handle the detox and
Exactly. Yeah.
Okay. Are you good on time? We have some questions that are coming in from the audience.
Sure.
But Alex, did you have any last ones you wanted to ask?
Yeah, one thing I think that what I'm amazed with in our practice is that people come in so dysregulated in so many ways that we're just trying to calm things down to begin with. And so we're going to be working with the limbic system and the vagus nerve, the nervous system. We're going to be trying to calm down the mast cells. But I'm just wondering if with certain mental health issues, are there certain neurotransmitters or certain supplements that you find really helpful for specific purposes? Like you mentioned that the dopamine and the serotonin oftentimes are depleted in some of these conditions. What do you do about things like that?
Well, I mean, it depends, because if they're already taking antidepressants or medications, you have to be really careful about certain supplements in combination. That doesn't mean to say that I avoid them completely. There are, for example, if somebody is already on Zoloft or sertraline and they've been on it for years and it's pooped out, I might add a little bit of 5-HTP just to give the synapse some serotonin so that it can allow the Zoloft to function better. But you just have to be careful about not overdoing it and making sure they don't have serotonin syndrome. But you have to look at all of the medications that can cause serotonin syndrome. So if they have migraines and they're taking all these migraine medication, or if they're Parkinson's and they're Parkinson's, like you have to look at the whole picture and make sure that you're being careful about adding certain supplements. I've had quite a few people have severe reactions to taurine. I haven't figured out why. And so I avoid that altogether in my practice. But there's other supplements like phenylalanine. I cannot say that word. There's maca root. There are certain supplements that you can give. It depends on the person and where they're at. What medications they're taking. So let's say they're not taking any medications. I like to use combinations of things. I don't know if you want me to say brands, but it's usually a combination of trying to think of specific ingredients. I mean, I personally like to to really focus on the root causes and address them. So I find adrenal insufficiency, HPA axis dysfunction is better to address. I'm really an upstream girl. And I tend to give supplements downstream only if they're like really having a lot of difficulty. So for example, PEA is really great for intrusive thoughts and OCD type symptoms. There's two different kinds of PEA, and the PEA that I'm talking about is phenylethylamine. It's a phospholipid. So phospholipids are really great for helping with neuroinflammation. It's common. There's combinations of PEA with phosphatidylcholine and phosphatidylserine. I love that combination for calming. It even helps a lot with sleep and helps with anxiety. So it is upstream because you're trying to repair the membranes with phospholipids. All your membranes are biphospholipid layers. It's two layers of phospholipids, like insulation around like an electrical wire. And if so much static, or I call it glitching, goes away. Just like how your lights in your house might glitch, if you don't have good insulation, same thing happens in our brain, believe it or not. And so by improving that and increasing your fat intake really improves the mitochondria functioning, getting more ketones into the brain cells because it crosses the blood-brain barrier, really helps with that. So I feel like if you can address these things upstream, you don't need the downstream supplements as much. That increases serotonin, dopamine, and other neurotransmitters. I feel like it's a Band-Aid, just like antidepressants. Conventional antidepressants are a Band-Aid, and so I tend to avoid that unless it's absolutely necessary. I love L-theanine and GABA. Again, GABA, you have to be careful with medications, but L-theanine, is great for kids that have anxiety. It's great for elderly who are having anxiety from dementia. And doses range from 100 milligrams to 800 milligrams throughout the day. So it's like a natural Xanax, and it doesn't interact with anything. It's just an amino acid. So what are some others? I'm trying to think of other ones because I just do this all day long. I was like, what is the supplement that I use? But yeah, L-theanine and GABA are big ones. And
acetylcholine analogs. Do you find a role for those?
Acetylcholine analogs. No, not really. I don't. Or can you name a specific one that I'm trying to think
Something
of?
Like huperzine or.
Yeah, I tend not. Oh, acetylcholine. You mean like huperzine and acetylcholine, and
yeah. I'm trying to think. There's one called Pyrasim Plus. I can't remember what the active ingredient is. But basically trying to augment parasympathetic function. It sounds like what you're talking about is you try to do broad swaths of things rather than going for the little.
Yeah, I mean, and the reason is because you can only give so many supplements. I mean, after a while, these things kind of add up. So I opt for going upstream and fixing the problem, because most people. I need a sip of water. Most people are already on medications by the time they see me. So, and so I have to be careful about interactions, and they're stably depressed. They're stably anxious. They have a lot going on. So I have to pick and choose, where am I going to put my efforts? And there's a cost to everything. They all add up, and there's only so many pills that a person can take, right? So that's why, the downstream supplements I don't tend to use often and unless necessary. And that's just my philosophy.
Thanks.
All right, I'm muted. All right. I'm trying to get some questions up for our audience here. So Karen's asking, would magnesium glycinate cross the blood-brain barrier? Talk about tongue twisters. And would it be safe to take at a higher dose for a child who's experiencing both anxiety and behavioral or PANS-esque symptoms?
If I remember correctly, I think magnesium threonate is the only magnesium that crosses the blood-brain barrier. But I have, from what I understand, that doesn't necessarily mean that these other magnesiums don't affect or help the brain. I don't know the mechanisms of action off the top of my head, but I find that magnesium glycinate is great for anxiety. Magnesium taurate is great for depression. And I would imagine that, these break up because the glycinate and the taurate are amino acids attached to magnesium for the delivery of it. So at some point these probably separate, and I don't know the exact science, but I do find it to be really helpful for anxiety. So I can't tell you what the mechanism of action is for that to happen. And as long as your kidney function is good, your body will cause you to have diarrhea if you take too much magnesium. So I personally increase the dose. Obviously, you want to still do this under the care of a professional, but I increase the dose until you still have loose stools, and then back off by a little bit, and go from there. Yeah.
Thanks. Okay, next one. Have had mold, Lyme for several years, receiving supportive treatment till can move out of mold. Cognitive issues are worsening. Is there a point which cognitive issues cannot be treated? So I hope that we can give this person some hope today.
Oh gosh, yeah. I think there's definitely a lot you can do. I've seen cognitive impairment get better, significantly better, even though a person might be living in a mold environment. So I can't speak to Lyme. I don't treat Lyme. I test for it and I refer out, because Lyme, I think you really need a Lyme literate doctor who goes to all the conferences and stays up on the treatment. So I can't really speak to that. But I know that there's treatments out there for that. It's finding someone who knows what they're doing, and has the experience and expertise to treat Lyme.
I would add also the person, look at how can you clean up the air that you're in? We talk a lot about that on here, about just how can you, some people, fogging isn't necessarily going to be remediation, but it might clean up the air enough that if you're maintaining your air that way until you can get out of, we sometimes see that help people.
Absolutely. Yeah. I can't see the whole question. It was cut off on the bottom here, but yeah, okay. I didn't see till can move out of it ends there. But anyway, yeah, I agree that especially in the summertime, if you can open all your windows, do that. Absolutely do that, and have fans blowing out the window. And there are filters that you can buy to filter out. It's not the solution, but it will certainly decrease your exposure and you inhaling it all. And you might even it might be worth just walling off the whole area. Certainly if your ventilation pathways are the same, then you're not going to be able to get away from it. But if you have baseboard heating and you don't have air conditioning and you can wall off that room with plastic, do so. But there are definitely filters you can buy that actually filter out the small mycotoxins. There, you have to be sure that you get the one that does that. I don't have the brand names off the top of my head right now, but they're out there for sure.
Stephen is saying, is it common for someone dealing with infections and toxicity to react incredibly poorly with exacerbation from psychiatric? He also wrote in another question, having reactions to antihistamine medications, despite clearly having mast cell activation syndrome and psych symptoms.
is it common for someone dealing with infections and toxicity to react incredibly poorly with exacerbation? So the question is it common for people to react poorly to psychiatric medication?
Yeah, I think that and he also, I'll just throw that one up there too, also having similar intense psych reactions to antihistamines. So clinically, what we see at Mast Cell 360 is this would allude to like the mast cell piece is the medication coming in is sending that danger signal to the body. And so what we do clinically is recommend the nervous system piece first has to be done in order to onboard these. Is that what you also see in your practice?
Absolutely, absolutely. Certainly the limbic activation, your body is reacting, just feeling in danger, because especially if you've had lots of trials and had poor experiences, your whole nervous system is going to just tense up and react right away. The limbic activation programs, or retraining programs, I should say, are definitely warranted. But there's also, you might also have some genetic SNPs, that it might be worth doing genetic testing and nutrigenomic testing and certain testing to see if that's playing a role as well. I'm assuming that liver detoxification has been addressed. Sometimes it has to do with congested liver issues that can cause these kinds of reactions as well. So it's looking at all of the possibilities and ruling them out one by one. But I would say number one, if it's ongoing and you've been in treatment for a while, then the limbic retraining would be the most important piece.
Naveed is asking, can mycotoxin exposure affect renal function?
Well, I mean, I think it affects liver function, renal function. I personally have not seen that. I'd have to. I don't know the answer to that question. It's a great question. Yeah.
I would say ochratoxin is like very much affects our kidneys. So sometimes we see clients with a really high ochratoxin A, and that can just really affect the kidneys, and we call it sort of a persister mycotoxin that can be bound with albumin. And we find bioflavonoids to help with that excretion.
Okay. Let's see.
I think we also see a lot of renal issues with high oxalate levels and from oxalates.
Yes. Yeah.
Yeah, definitely from high oxalates.
Yeah.
I don't know. Do you see children in your practice?
Yes, I do.
Okay, so Karen's asking, what limbic vagal program do you recommend for most kids ages 9 to 12? I'll say what we recommend here is that mom does a lot of nervous system regulation herself because children are co-regulating, but I'd love to hear what you recommend.
I haven't recommended a program to a child recently, so I'm not familiar with the program specifically for children. It just hasn't come up. I see mostly adults, but I do see also some children. Yeah.
Okay, let's see. Marcia is asking, what are your thoughts on structural contributions to immune dysfunction such as cranial cervical instability?
That's a great question. Yeah, being a DO, doctor of osteopathy, I've been trained in osteopathic, oh my God, manual medicine, to a degree, because I am a psychiatrist, but, we learn a lot about how the structure affects function. And so it is important when I do a physical exam, I do look at the way a person sits, their gait, their posture, all that really makes a difference because, your brain, has the spinal cord that innervates all of your facets of the spine, which then innervates every single organ. And when, you can cause impingement of those nerves and depending on where, what the posture or how a person carries themselves, or if they've had injuries. So, T4 can affect, if there's an impingement or what we call an osteopathic lesion at T4, they can cause gallbladder issues. So it's really important to look at those things and understand that you can have immune dysfunction just from some part of the spine having impingements of, depending on where it is, down to the all the way down to the sacrum. And as you know, the vagus nerve also, innervates from the base of the skull all the way down through and innervates every single organ down to your sacrum. So it's all integrated. And even the gut has its own nervous system, and they all talk to each other. So you can absolutely have immune dysfunction as a result of, issues in these areas. And so doing massage, medical massage, craniosacral therapy, physical therapy, really addressing posture. I had a patient who I referred to, a person that does OMT like day in and day out. That's just their job, sports therapy, and to look at this patient's posture. And it almost made me think that it was almost like a crouching in, like that's the way the person sat. And this is like a 20-year-old, not somebody who's in their 80s. And I explained to him that, it would be really important to start sitting up and just pulling your shoulders back and it looked to me that it was to the degree that the back muscles were very, very weak. And so just changing posture can make a huge difference. And if you think about it, when you're scrunched over like that, you're impinging your esophagus, your stomach, there's so many organs that are just getting crushed by how much a person is crouched over. But it makes me also think there must be some trauma there just because of the way they're like this, right? Like, what are you trying to protect yourself from? So you can look at so many factors related just from the posture, read into that. And then, you don't want to assume these things, but at some point it's in the back of my mind that I need to really do, when it's safe and feels comfortable, to talk about trauma, and how did you get even into this position? How long ago? When did it start? Who are you protecting yourself from, right? So it brings up a lot of questions when you see someone sitting like that, but it can also cause a lot of physical, issues, and especially if you're chronically sitting in that position, right?
Yeah. Thank you. On the back end, Elle shared some stuff going back to kids, something like primitive reflex integration or craniosacral may be a route to go as well. Mm-hmm. Okay, we've gone over. Are you still good on time? Because I just want to finish with like one, so many people, even if it's just brain fog, like that's neurological, right? And I don't know, nowadays, I feel like you talk to even people who don't have mast cell activation syndrome or mold toxicity, and they're like, I forget why I walked into that room 2 seconds ago, right? So I think the majority of us are experiencing brain fog. But what if we could leave people with some practical ways to begin like supporting brain health when they're dealing with complex health issues? What would that advice be? Or what would be some practical ways that they could start supporting their brain health?
Well, believe it or not, taking a deep breath makes a big difference. People are always up here in their chest. They really don't breathe well. It's amazing. And many people just don't even realize it. So, and they don't you can actually look on the comprehensive metabolic panel and look at the CO2. And if you're in the teens, you're not breathing. You want to be up in the mid 20s, just looking on the CMP, you know that a person, and that breath work can actually change you metabolically. So, so it's taking a breath, doing breath work is really important. Eating more fat, eating fat your brain needs fat. Your brain is 80% fat. And I know, we've been told for decades, don't eat fat, but you want to eat healthy fats, avocados, nuts. And, I think butter is great unless you are sensitive to dairy. I generally have people who are in my practice are gluten and dairy free, especially in the beginning, just to sort of unmuddy the puddle. But if we are trying to get more fats into the body, eating butter, as actually butter provides butyrate, which feeds the gut. It's short chain fatty acids right in butter. And so eat a lot of vegetables. And if it tastes better with butter, then do so, as long as you're not sensitive to dairy, then I think it's worth trying and seeing how you feel. But I think it's also doing one thing at a time. People get very, very overwhelmed, especially when you have mast cell, you're already overwhelmed. So focusing, I provide a pretty complicated treatment plan, but then I have a health coach just sort of unpack it and start with lowest hanging fruit. But it's just doing one thing at a time. You will get through all the things. So focus on one thing, get that one thing down, then go to the next thing. So I think, that's a good place to start. But there's definitely, I've seen people who are really, really sick and get well. I mean, it takes time. So it's important to believe in yourself. You want to do it for you, not for your family. You do it for yourself. You believe in yourself, and you have goals of where you want to be. Have a sense of purpose in what you want to do when you're well. Have that in mind. Really, really important to have that in mind.
Yeah, absolutely. Mm-hmm. Thank you so much. Yeah, and we use the multi-practitioner method here at Mast Cell 360 as well, with lead practitioners Alex and Kimberly, and we have myself as a health coach and Cam as a health coach as well. So, it's important to be able to have the big picture, but then what is that next step for you? Some people really need that, second set of eyes to kind of guide and hold hands sometimes.
Absolutely.
That brings me to, if anyone listening today is interested in kind of taking that next step and realizing oh, where am I going now that I have all this information? I want to test for mold. Maybe I wasn't aware that mold may be affecting my mast cells and my nervous system and my, thoughts and moods. So you can work with us in two ways. Our foundational sessions, our strategy sessions, are working with myself or Cam, just to kind of get those quick next steps. What are we really, looking for? And we can kind of help answer some of these questions. If you were to get testing on your own, I'll have Zach drop in the comments the mold testing that we recommend. It's a real-time lab test. Some of the other ones you do need lead practitioners, or not necessarily a doctor to order, but, we start with mold. So just, in the effort of keeping it simple, that would be the one that we recommend first if you haven't tested for mold. And we can do that in a strategy session. But if you're looking for that really long-term ongoing support, that would be our advanced approach. And you can find both of those at mastcell360.com/application. And then I want to also let everyone know that you can read the first 3 chapters of Dr. Stein's book, What If It's Not Depression, by going to achinasteindio.com/book. And Dr. Stein, is there anything else that you would like to leave our audience with today?
Yeah, I mean, I think, you need to know that there is absolutely hope. I've seen, like I said, I've seen really sick people get very, very well and have a vibrant life with energy, no depression, no anxiety. It does take time. That's the thing with chronic disease. It does take time but I've seen diabetes reverse. I've seen mold toxin illness reverse. I've seen people no longer be in pain, and really starting, leading vibrant lives. I've even seen autism reverse. It's the big thing in the news right now. But it takes time, but it's all of it is reversible. a lot of it, I shouldn't say all of it, a lot of it is reversible, and it's taking one step at a time.
And for those who are experiencing a lot of anxiety or depression symptoms and mold wasn't on your radar, I do want to give you guys another free resource that you can find, mastcell360.com/mold guide. It's a new resource we came out with. It has a quiz to see, is mold possibly behind some of those symptoms that you're experiencing? And it gives some top tips on gentle detox. So there's that free resource, as well as just letting you guys know our mold course is on sale for just a little bit longer, I think 1 more week. And this is a step-by-step guide to kind of get you order of operations. How do you test? Understanding what that test means, and then maybe those first steps that you can take to detox from the mold. So Dr. Stein, thank you so much for being with us today. I just want to open it up. Feel free to unmute Alex and Kimberly and Elle and share any last pieces of hope for our audience today.
I so agree with what you said about not giving up hope, and that to just, and if you're not getting what you need out of your provider, there's other providers. You're not stuck with one thing. Mm-hmm. New things are coming out all the time, new understandings, and, just talking to people. Who do they go to? What do they see? Going to chat rooms can be good. They can be full of negativity as well, but just keep searching, be your own advocate.
Right.
Yeah. I would say start where you are. Take that next step, because it can look overwhelming, right? When you look at the big picture, but come back to who are you and what is your next step? Have you tested for mold? Okay. Maybe you just test for mold and kind of go from there. The next piece.
Right.
Like Alex said, there's new things coming out all the time. So even that concept of supporting our posture, if you're in a place where you need to do that, sometimes it can be really challenging to get there. And so the sports I include under my yoga training, which are actually very different, other advanced bodywork supports can help people get there. So we can, just again, meet you where you are. And sometimes we don't realize what exactly is impacting us or how. And so it can be a good way to explore that and support through that.
Yeah. And I liked what you said about what's one thing that people can just start doing is taking that deep breath. And so that leads me into next week. We are actually having somebody on who's going to talk about just that, establishing that ability to properly take a deep breath. Because like you said, we're all up here. It's how do we evaluate on a day-to-day basis where we're breathing into in our bodies? And so thank you so much for being with us today, Dr. Stein. And for those who are oh yeah, I'm not breathing, please tune in with us next week. It was so great to be with everyone today. Thank you for being here, and we appreciate your time.
Thank you. It's my pleasure.